So we're going to now have 4 presentations. So we're going to start with Dr. Melinda Judge, who's just here. So Melinda is a postdoctoral researcher at the Kids Research Institute in Australia. She's one of the co-authors of there's many papers that kind of sit underneath this, and she's part of the Future Child Health team at Kids Institute in Australia. And she's predominantly going to talk about the kind of methodological parts of this research.
So firstly, as an Australian, I'd like to acknowledge the Aboriginal and Torres Strait Islander people as the traditional custodians of the unceded land and waters of Australia, and pay my respects to their elders, past and present. In Australia, there's continued disparity in outcomes for First Nations kids compared with other Australian children, and working to close this gap is embedded in all the research that we do at the Research Institute where I work. Inequity in child health outcomes, however, is a global issue, and our research shows that it's worsening, and we're trying to address that. So today, this little overview, I will talk about the current UN child mortality projection and how they're likely underestimate because child mortality, we believe, will increase due to both increasing population density and accelerating climate change. So I'll discuss how children will be impacted differently across the globe, and how this is particularly concerning given that infant mortality is the largest driver of fertility. So more children will be born into places with rapidly growing populations, and that can contribute, also those people contribute the least to climate change, but they'll be most impacted by it. So here we have the UN historical data for child mortality rates in the solid lines. So the coloured lines are the different regions, and the black here is the global average. And the dotted lines show the UN projections for future child mortality to the end of the century. And this continuing decline appears reassuring, but we really question if this is accurate, because we know progress is slowing, and we know that there are lots of countries that aren't on track to meet the Sustainable Development Goal to reduce child mortality to below that threshold of 25 per 1,000 live births. So we looked at how these projections were determined. And firstly, I want to say, like, as someone who works with data and does modelling, it inherently requires assumptions to be made. So that can be really difficult to figure out what those assumptions are meant to be. And when you're working with incomplete or inaccurate data, such as the case for global child mortality data, it really does make the job difficult. So going forward, so we had a little look at how the projections are currently worked out, and it's really an extrapolate and adjust model. So the previous gains in reductions in child mortality are extrapolated forward into the future, and adjustments are made for HIV/AIDS and crisis events. So there are 9 factors that are considered in the crisis events, and they consist of conflict, extreme weather events, and epidemics. So, and they also look at making a 90% confidence interval. So they believe that the true child mortality rate is 90% covered. However, based on our research, we believe that these projections of the previous gains in lowering child mortality are underestimates because they lack adjustment for population growth and climate change. So both of which directly and indirectly impact child health. And of the 9 crisis events that are calculated, we believe that there are about 5 that are directly impacted by population growth, and 7 that are impacted by climate change. But again, these are historical, what's happened in the past, and it's not accounting for increases going forward. And it also doesn't account for larger population, more kids being impacted. So this is a preprint. This is currently under review. and you can access it if you want. Peter will talk about this more in depth shortly, but I just wanted to talk about an aspect that I did of this. So as part of this paper, looking at the impacts of population density on child health, I did a literature search. And from that, I found 40 papers that directly looked at population density and impacts on pregnancy, infant health, child health, and then whole population, but specifically including the child cohort. So what we found that there's large differences in the impacts on population density in low versus high income countries. So first I'll talk about low income countries. And there is a consistent theme in low income countries that when increasing population is associated with improved access to healthcare, there are benefits. So we saw one study of pregnant women where there were improvements due to healthcare access, one on infant mortality, one on childhood stunting, underweight and wasting, and another on improved vaccine coverage and associated outcomes. But independent of the co-benefits of improved healthcare access, increased population density was found to increase the risk of neonatal and perinatal mortality, as well as under 5 mortality. There were also increases in respiratory infections, enteric disease and diarrhea, reductions in cognitive abilities, more sleep disorders, predisposition to diabetes, increased risk of COVID, increased air pollution-related respiratory disease, higher body mass index in some communities, while there were increases in childhood studies in others, stunting in others, and increased risk of typhoid and more vector-borne disease. So the results for high-income countries there were a lot fewer studies and it was really variable. So high population density was correlated with lower rates of teenage pregnancy, but higher rates of breast milk fungal contamination, both increased and decreased child body mass index, reduced bronchiolitis-related hospitalisation, less binge drinking, and less irritable bowel disease. So it's quite a diverse literature. But while there is variability in child health outcomes, for most of the world's children, in the absence of improved healthcare, the high population growth contributes to the spread of infectious disease and vector-borne diseases, pollution-related illness, adverse nutritional outcomes, and death. So next I'll talk about some of the work that we've done. So on climate change and child health outcomes. So we did a systematic review and meta-analysis led by our colleague Lewis Weeder, and we looked at how measured aspects of climate change impact quantifiable child health outcomes. So Peter will talk about this in more detail, but I just wanted to give a little bit of an overview here. So what we found is that the most studies were done on temperature extremes and air pollution, and definitely heat. Heat was the leading contributor to preterm birth, respiratory disease, and mortality and hospitalizations for children, while cold extremes also impacted preterm birth and respiratory disease. And poor air quality had huge impacts on, obviously, respiratory disease, but also inducing that also impacted premature birth. And we know that preterm birth children have lifelong problems sometimes, particularly respiratory disease, so it's an additive effect. So it's also important to note that these two environmental factors are not included in the UN child mortality projections. So there's no mention of heat and there's no mention of air pollution. So we also saw that too little or too much rainfall impacted gastrointestinal disease and stunting in children. So we need to note that 96% of these studies were done in high income or upper middle income countries. So only 2% were in lower middle income countries and 2% in low income countries. So although that we can see that the climate variables are largely impacting child health, it's likely a huge underrepresentation of what's actually going on globally. So in 2021, UNICEF released the Children's Climate Risk Index, which consists of two pillars. So children are exposed to different environmental shocks and stresses, depending on where they live. So such as heat waves, air pollution, and extreme weather events. And then the other pillar comprises of the child vulnerability score. So underlying child-specific variables, nutrition, education. So the Children's Climate Risk Index is a combination of these. And so for context, the highest risk is for Central African Republic, and they have both the highest Pillar 2 risk, and that's therefore the highest overall risk. Bangladesh has the highest Pillar 1 risk, so those children in Bangladesh are exposed to the most climate shocks, and they have overall quite a high risk index. Iceland is low across the board. The children are at quite low risk. And I've put Australia in here because I'm going to come back to that later. We have a moderate Pillar 1 and a low Pillar 2 score, so overall a relatively low risk. But here we have the distribution globally of the Pillar 1 factors in the orange. So that's how climate is changing and how those people in how those countries are going to be impacted by the effects of climate change. Pillar 2, so the child vulnerability score is in the blue, and the purple is the combination. So you can see that the countries where the most children will be born in the near future are those with the highest risk to climate change. So we then did a study in Australia, because we're Australians and we have access to the data. So we wanted to look at the determinants of mortality in under 5s in Australia. And so we included a lot of determinants of child health. So income, education, housing, access to healthcare, and we also threw in a bunch of climate variables. And after all the analysis, only the climate variables, income and household size were retained in the model. So heat and bushfire, smoke exposure were the largest contributing factors to child mortality in Australia. And that's a bit terrifying because every year we keep breaking records, more heat waves, hotter temperatures, and bushfire is right, if you've seen the news. So, next slide, please. So some of our other work that we've looked at is determinants of fertility. So we looked at fertility in 64 low and middle income countries. And this slide is about to get really busy, but I'll talk it through quite simply. We used nationally aggregated data that was publicly available for a number of sources. And we categorized the variables into 6 themes. So theme 1 was the availability of family planning services. Theme 2 was the quality of those family planning services. Theme 3 was women's education. Theme 4 was religion. Theme 5, infant mortality, and theme 6 was socioeconomic. So we did some complicated statistical methodology. All of our code is available online if anyone is interested. GitHub is up there if you want to get that. But basically, at the end of the day, I'll talk you through our results. So the figure on this one shows the relative contribution of each variable to the variance in fertility, with the grey bars being the raw values and the black bars being the bootstrapped values. So this is the ranking of the variables and how much they contribute to fertility, with infant mortality being the largest predictor of high fertility, followed by household size, which we use as a proxy of population density, and access to contraception. Out of all of the variables that were listed in the previous slide, it's only quality of family planning services as well, more years of maternal education, religion, and access to community health workers that also contribute to national level fertility rates. And on the right, you can see the response curves that show the individual variable, how it's related affects fertility. So figure B shows that high infant mortality in a country The higher the infant mortality, the higher the fertility. Likewise for household size, and the opposite is true for access to contraception. And the others also have smaller, but statistically significant contribution. So certainly the largest effect size was observed between fertility and infant mortality. So once infant mortality has exceeded a threshold of 0.0282, so 28.2 infant deaths per 1,000 live births, fertility increases precipitously. So this is highly concerning to us because we believe that the child mortality projections are underestimates and that many countries that already aren't on track to meet the Sustainable Development Goals of reducing child mortality, they're the ones that remain above this threshold. So in conclusion, the current child mortality predictions are extrapolations of historical trends with adjustments for HIV and crisis events. But the projections don't currently adjust for increasing population density and accelerating climate change. And we know that these will have large impacts on child health. Increasing population density directly impacts child health. And while there are benefits associated with increased healthcare accessibility, in the absence of this, the impacts are very detrimental to child health outcomes. We know that temperature extremes and air pollution are the leading climate variables that impact child health, including mortality. And both climate stresses and child vulnerability are unequally distributed globally. So countries with already high child mortality rates will be the most affected. And given that child mortality is the leading contributor to fertility, more children will be born into the most vulnerable regions. Thank you.